双语音标领航，注音阅读启蒙，叶兴阳有声读物。
Anomalies and Curiosities of Medicine by George M. Gould and Walter L. Pyle. Anomalies and Curiosities of Medicine. Being an encyclopedic collection of rare and extraordinary cases, and of the most striking instances of abnormality in all branches of medicine and surgery, derived from an exhaustive research of medical literature from its origin to the present day, abstracted, classified, annotated, and indexed by George M. Gould,
A.M.,
M.D. and Walter L. Pyle,
A.M.,
M.D. Prefatory and Introductory. Since the time when man's mind first busied itself with subjects beyond his own self-preservation and the satisfaction of his bodily appetites, the anomalous and curious have been of exceptional and persistent fascination to him, and especially is this true of the construction and functions of the human body.
Possibly. Indeed.
It was the anomalous that was largely instrumental in arousing in the savage the attention, thought, and investigation that were finally to develop into the body of organized truth, which we now call science. As by the aid of collected experience and careful inference, we today endeavor to pass our vision into the dim twilight whence has emerged our civilization, we find abundant hint and even evidence of this truth. To the highest type of philosophic minds, it is the usual and the ordinary that demand investigation and explanation. But even to such, no less than to the most naive-minded, the strange and exceptional is of absorbing interest. And it is often through the extraordinary that the philosopher gets the most searching glimpses into the heart of the mystery of the ordinary. Truly it has been said, facts are stranger than fiction. In monstrosities and dermoid cysts, for example, we seem to catch forbidden sight of the secret workroom of nature, and drag out into the light the evidences of her clumsiness, and proofs of her lapses of skill, evidences and proofs, moreover, that tell us much of the methods and means used by the vital artisan of life, the loom, and even the silent weaver at work upon the mysterious garment of corporeality.
La première chose qui s'offre à l'homme quand il se regarde, c'est son corps,
says Pascal. And looking at the matter more closely, we find that it was the strange and mysterious things of his body that occupied man's earliest, as well as much of his later attention. In the beginning, the organs and functions of generation, the mysteries of sex, not the routine of digestion or of locomotion, stimulated his curiosity, and in them he recognized, as it were, an unseen hand reaching down into the world of matter and the workings of bodily organization, and reining them to impersonal service and far-off ends. All ethnologists and students of primitive religion well know the role that has been played in primitive society by the genetic instincts. Among the older naturalists, such as Pliny and Aristotle, and even in the older historians, whose scope included natural as well as civil and political history, the atypic and bizarre, and especially the aberrations of form or function of the generative organs, caught the eye most quickly. Judging from the records of early writers, when medicine began to struggle towards self-consciousness, it was again the same order of facts that was singled out by the attention. The very names applied by the early anatomists to many structures so widely separated from the organs of generation, as were those of the brain, give testimony of the state of mind that led to and dominated the practice of dissection. In the literature of the past centuries, the predominance of the interest in the curious is exemplified in the almost ludicrously monotonous iteration of titles, in which the conspicuous words are curiosa,
rara,
monstruosa, memorabilia, prodigiosa, selecta, exotica, miraculi, lusibus naturae, occultus naturae, etc., etc. Even when medical science became more strict, it was largely the curious and rare that were thought worthy of chronicling, and not the establishment or illustration of the common, or of general principles. With all his sovereign sound sense, Ambrose Pare has loaded his book with references to impossibly strange, and even mythologic cases. In our day the taste seems to be insatiable, And hardly any medical journal is without its rare or unique case, or one noteworthy chiefly by reason of its anomalous features. A curious case is invariably reported, and the insertion of such a report is generally productive of correspondence and discussion with the object of finding a parallel for it. In view of all this, it seems itself a curious fact that there has never been any systematic gathering of medical curiosities. It would have been most natural that numerous encyclopedias should spring into existence in response to such a persistently dominant interest. The four-ling volume appears to be the first thorough attempt to classify and epitomize the literature of this nature. It has been our purpose to briefly summarize and to arrange in order the records of the most curious, bizarre, and abnormal cases that are found in medical literature of all ages and all languages, Thaumatrographia Medica. It will be readily seen that such a collection must have a function far beyond the satisfaction of mere curiosity, even if that be stigmatized with the word idle.
If,
as we believe, reference may here be found to all such cases in the literature of medicine, including anatomy, physiology, surgery, obstetrics, etc., as show the most extreme and exceptional departures from the ordinary, it follows that the future clinician and investigator must have use for a handbook that decides whether his own strange case has already been paralleled or excelled. He will thus be aided in determining the truth of his statements and the accuracy of his diagnoses. Moreover, to know extremes gives directly some knowledge of means, and by implication and inference it frequently does more. Remarkable injuries illustrate to what extent tissues and organs may be damaged without resultant death, and thus the surgeon is encouraged to proceed to his operation with greater confidence and more definite knowledge as to the issue. If a mad cow may blindly play the part of a successful obstetrician with her horns, certainly a skilled surgeon may hazard entering the womb with his knife. If large portions of an organ, the lung, a kidney, parts of the liver, or the brain itself, may be lost by accident, and the patient still live, the physician is taught the lesson of nil desperandum, and that if possible to arrest disease of these organs before their total destruction. The prognosis and treatment thereby acquire new and more hopeful phases. Directly or indirectly, many similar examples have also clear medico-legal bearings or suggestions. In fact, it must be acknowledged that much of the importance of medical jurisprudence lies in a thorough comprehension of the anomalous and rare cases in medicine. Expert medical testimony has its chief value in showing the possibilities of the occurrence of alleged extreme cases and extraordinary deviations from the natural. Every expert witness should be able to maintain his argument by a full citation of parallels to any remarkable theory or hypothesis advanced by his clients. And it is only by an exhaustive knowledge of extremes and anomalies that an authority on medical jurisprudence can hope to substantiate his testimony beyond question. In every poisoning case, he is closely questioned as to the largest dose of the drug in question that has been taken with impunity, and the smallest dose that has killed, and he is expected to have the cases of reported idiosyncrasies and tolerance at his immediate command. A widow with a child of 10 months gestation may be saved the loss of reputation by mention of the authentic cases in which pregnancy has exceeded 9 months' duration. The proof of the viability of a 7 months' child may alter the disposition of an estate. The proof of death by a blow on the epigastrium without external marks of violence may convict a murderer. And so it is with many other cases of a medico-legal nature. It is noteworthy that in old-time medical literature, sadly and unjustly neglected in our rage for the new, should so often be found parallels of our most wonderful and peculiar modern cases. We wish, also, to enter a mild protest against the modern egotism that would set aside with a sneer as myth and fancy the testimonies and reports of philosophers and physicians, only because they lived hundreds of years ago. We are keenly appreciative of the power exercised by the myth-making faculty in the past, but as applied to early physicians, we suggest that the suspicion may easily be too active. When Pear, for example, pictures a monster, we may distrust his art, his artist, or his engraver. and make all due allowance for his primitive knowledge of teratology, coupled with the exaggerations and inventions of the wonder lover. But when he describes in his own writing what he or his confreres have seen on the battlefield or in the dissecting room, we think, within moderate limits, we owe him credence. For the rest, we doubt not that the modern reporter is, to be mild, quite as much of a myth-maker as his elder brother, especially if we find modern instances that are essentially like the older cases reported in reputable journals or books, and by men presumably honest. In our collection we have endeavored, so far as possible, to cite similar cases from the older and from the more recent literature. This connection suggests the question of credibility in general. It need hardly be said that the lay journalist and newspaper reporter have usually been ignored by us, simply because experience and investigation have many times proved that a scientific fact, by presentation in most lay journals, becomes in some mysterious manner, ipso facto, a scientific caricature or worse. And, if it is so with facts, what must be the effect upon reports based upon no fact whatsoever? It is manifestly impossible for us to guarantee the credibility of chronicles given. If we have been reasonably certain of unreliability, we may not even have mentioned the marvelous statement. Obviously, we could do no more with apparently credible cases reported by reputable medical men than to cite author and source and leave the matter there, where our responsibility must end. But where our proper responsibility seemed likely never to end was in carrying out the enormous labor requisite for a reasonable certainty that we had omitted no searching that might lead to undiscovered facts. Ancient or modern. Choice and selection is always, of course, an affaire de gustibus, and especially when, like the present, there is considerable embarrassment of riches, coupled with the purpose of compressing our results in one handy volume. In brief, it may be said that several years of exhaustive research have been spent by us in the great medical libraries of the United States and Europe in collecting the material herewith presented. If, despite of this, omissions and errors are to be found, we shall be grateful to have them pointed out. It must be remembered that limits of space have forbidden satisfactory discussion of the cases, and the prime object of the whole work has been to carefully collect and group the anomalies and curiosities, and allow the reader to form his own conclusions and make his own deductions. As the entire labor in the preparation of the four-leading volume, from the inception of the idea to the completion of the index, has been exclusively the personal work of the authors, it is with full confidence of the authenticity of the reports quoted that the material is presented. Complete references are given to those facts that are comparatively unknown or unique, or that are worthy of particular interest or further investigation, to prevent unnecessary loading of the book with footnotes. In those instances in which there are a number of cases of the same nature, and a description has not been thought necessary, mere citation being sufficient, references are but briefly given or omitted altogether. For the same reason, a bibliographic index has been added at the end of the text. This contains the most important sources of information used, and each journal or book therein has its own number, which is used in its stead all through the book. Thus, 476 signifies The Lancet, London, 597, the New York Medical Journal, etc. These bibliographic numbers begin at 100. Notwithstanding that every effort has been made to conveniently and satisfactorily group the thousands of cases contained in the book, a labor of no small proportions in itself. A complete general index is a practical necessity for the full success of what is essentially a reference volume, and consequently one has been added, in which may be found not only the subjects under consideration and numerous cross-references, but also the names of the authors of the most important reports. A table of contents follows this preface. We assume the responsibility for innovations in orthography, certain abbreviations, and the occasional substitution of figures for large numerals, fractions, and decimals, made necessary by limited space, and in some cases to more lucidly show tables and statistics. From the variety of the reports, Uniformity of nomenclature and numeration is almost impossible. As we contemplate constantly increasing our data, we shall be glad to receive information of any unpublished anomalous or curious cases, either of the past or in the future. For many courtesies, most generously extended in aiding our research work, we wish, among others, to acknowledge our especial gratitude and indebtedness to the officers and assistants of the Surgeon General's Library at Washington, D.C., the Library of the Royal College of Surgeons of London, the Library of the British Museum, the Library of the British Medical Association, the Bibliothèque de Faculté de Médecine de Paris, the Bibliothèque Nationale, and the Library of the College of Physicians of Philadelphia. George M. Gould. Philadelphia, October, 1896. Walter L. Pyle. Table of Contents. Chapter pages I. Genetic Anomalies. 17 to 49.
2.
Prenatal Anomalies. Point 50-112. 3. Obstetric Anomalies. 113 to 143. 4. Prolificity. 144-160. V. Major Terata. 161 to 212. 6. Minor Terata. Point 213-323. 7. Anomalies of stature,
Size,
and development. Point 324-364. 8. Longevity. Point 365-382.
9.
Physiologic and functional anomalies. Point 383-526. X. Surgical anomalies of the head and neck. 527 to 587. 11. Surgical anomalies of the extremities. 588 to 605. 12. Surgical anomalies of the thorax and abdomen. Point 606-666. 13. Surgical anomalies of the genitourinary system. 667-696. 14. Miscellaneous surgical anomalies. 697 to 758. 15. Anomalous types and instances of disease. 759-822.
16.
Anomalous skin diseases. 823 to 851. 17. Anomalous nervous and mental diseases. 852-890. 18. Historic epidemics. 891 to 914. Anomalies and Curiosities of Medicine. Chapter 1. Genetic Anomalies. Menstruation has always been of interest, not only to the student of medicine, but to the lay observer as well. In olden times there were many opinions concerning its causation, all of which, until the era of physiologic investigation, were of superstitious derivation. Believing menstruation to be the natural means of exit of the feminine bodily impurities, the ancients always thought a menstruating woman was to be shunned. Her very presence was deleterious to the whole animal economy.
As,
for instance, among the older writers we find that Pliny remarks, on the approach of a woman in this state, must will become sour. Seeds which are touched by her become sterile. Grass withers away, garden plants are parched up, and the fruit will fall from the tree beneath which she sits. He also says that the menstruating women in Cappadocia were perambulated about the fields to preserve the vegetation from worms and caterpillars. According to Fleming, menstrual blood was believed to be so powerful that the mere touch of a menstruating woman would render vines and all kinds of fruit trees sterile. Among the indigenous Australians, menstrual superstition was so intense that one of the native blacks, who discovered his wife lying on his blanket during her menstrual period, killed her, and died of terror himself in a fortnight. Hence, Australian women during this season are forbidden to touch anything that men use. Aristotle said that the very look of a menstruating woman would take the polish out of a mirror, and the next person looking in it would be bewitched. From Man mentions a man who said he saw a tree in Goa which withered because a catamenial napkin was hung on it. Burke remarks that the dread felt by the American Indians in this respect corresponds with the particulars recited by Pliny. Squaws at the time of menstrual purgation are obliged to seclude themselves, and in most instances to occupy isolated lodges, and in all tribes are forbidden to prepare food for anyone save themselves. It was believed that, were a menstruating woman to step astride a rifle, a bow, or a lance, the weapon would have no utility. Medicine men are in the habit of making a protective clause whenever they concoct a medicine, which is to the effect that the medicine will be effective provided that no woman in this condition is allowed to approach the tent of the official in charge. Empiricism had doubtless taught the ancient husbands the dangers of sexual intercourse during this period, and the after-results of many such connections were looked upon as manifestations of the contagiousness of the evil excretions issuing at this period. Hence, at one time menstruation was held in much awe and abhorrence. On the other hand, in some of the Eastern countries menstruation was regarded as sacred, and the first menstrual discharge was considered so valuable that premenstrual marriages were inaugurated in order that the first ovum might not be wasted, but fertilized, because it was supposed to be the purest and best for the purpose. Such customs are extant at the present day in some parts of India, despite the efforts of the British government to suppress them, and descriptions of child marriages and their evil results have often been given by missionaries. As the advances of physiology enlighten the mind as to the true nature of the menstrual period, and the age of superstition gradually disappeared, the intense interest in menstruation vanished, and now, rather than being held in fear and awe, the physicians of today constantly see the results of copulation during this period. The uncontrollable desire of the husband and the mercenary aims of the prostitute furnish examples of modern disregard. The anomalies of menstruation must naturally have attracted much attention, and we find medical literature of all times replete with examples. While some are simply examples of vicarious or compensatory menstruation, and were so explained even by the older writers, there are many that are physiologic curiosities of considerable interest. Laradier furnishes the oft-quoted history of the case of a young girl who suffered from suppression of menses, which, instead of flowing through the natural channels, issued periodically from vesicles on the leg for a period of 6 months, when the seat of the discharge changed to an eruption on the left arm, and continued in this location for 1 year. Then the discharge shifted to a sore on the thumb, and, at the end of another 6 months again changed, the next location being on the upper eyelid. Here it continued for a period of 2 years. Brière de Boismont and Meisner describe a case apparently identical with the foregoing, though not quoting the source. Haller, in a collection of physiologic curiosities covering a period of 1.5 centuries, cites 18 instances of menstruation from the skin. Parrott has also mentioned several cases of this nature. Chambers speaks of bloody sweat occurring periodically in a woman of 27. The intervals, however, were occasionally but a week or a fortnight, and the exudation was not confined to any one locality. Van Swieten quotes the history of a case of suppression of the menstrual function in which there were convulsive contractions of the body, followed by paralysis of the right arm. Later on, the patient received a blow on the left eye causing amaurosis. Swelling of this organ followed, and 1 month later blood issued from it, and subsequently blood oozed from the skin of the nose, and ran in jets from the skin of the fingers and from the nails. D'Andrade cites an account of a healthy Parsi lady, 18 years of age, who menstruated regularly from 13 to 15.5 years. The catamenia then became irregular, and she suffered occasional hemorrhages from the gums and nose, together with attacks of hematemesis. The menstruation returned, but she never became pregnant, and, later, blood issued from the healthy skin of the left breast and right forearm, recurring every month or 2, and finally additional dermal hemorrhage developed on the forehead. Microscopic examination of the exuded blood showed usual constituents present. There are 2 somewhat similar cases spoken of in French literature. The first was that of a young lady who, after 10 years' suppression of the menstrual discharge, exhibited the flow from a vesicular eruption on the finger. The other case was quite peculiar, the woman being a prostitute, who menstruated from time to time through spots the size of a 5-franc piece, developing on the breasts, buttocks, back, axilla, and epigastrium. Barham records a case similar to the foregoing, in which the menstruation assumed the character of periodic purpura. Duchesne mentions an instance of complete amenorrhea, in which the ordinary flow was replaced by periodic sweats. Parrott speaks of a woman who, when 7 months old, suffered from strumous ulcers, which left cicatrices on the right hand, from whence, at the age of 6 years, issued a sanguineous discharge with associate convulsions. One day, while in violent grief, she shed bloody tears. She menstruated at the age of 11 and was temporarily improved in her condition, but after any strong emotion the hemorrhages returned. The subsidence of the bleeding followed her first pregnancy, but subsequently, on one occasion, when the menses were a few days in arrears, she exhibited a blood-like exudation from the forehead, eyelids, and scalp. As in the case under D'André's observation, the exudation was found by microscopic examination to consist of the true constituents of blood. An additional element of complication in this case was the occurrence of occasional attacks of hematemesis, menstruation from the breasts, being in close sympathy with the generative function. We would naturally expect to find the female mammy involved in cases of anomalous menstruation, and the truth of this supposition is substantiated in the abundance of such cases on record. Schenck reports instances of menstruation from the nipple, and Richter, de Fontecchia, Laurentius, Marcellus Donatus, Amadus Lusitanus, and Burling are some of the older writers who have observed this anomaly. Père says the wife of Pierre de Feur, an iron merchant, living at Chastauden, menstruated such quantities from the breasts each month that several serviettes were necessary to receive the discharge. Cazenave details the history of a case in which the mammary menstruation was associated with a similar exudation from the face, and Wolff saw an example associated with hemorrhage from the fauces. In the Lancet, 1840–1841, is an instance of monthly discharge from beneath the left mamma. Finlay also writes of an example of mammary hemorrhage simulating menstruation. Barnes saw a case in St. George's Hospital, London, 1876, in which the young girl menstruated vicariously from the nipple and stomach. In a London discussion, there was mentioned the case of a healthy woman of 50 who never was pregnant, and whose menstruation had ceased 2 years previously, but who for 12 months had menstruated regularly from the nipples, the hemorrhage being so profuse as to require constant change of napkins. The mammae were large and painful, and the accompanying symptoms were those of ordinary menstruation. Bulger mentions an instance of periodic menstrual discharge from beneath the left mamma. Jacobson speaks of habitual menstruation by both breasts. Rouault describes amenorrhea in a girl of 17, who menstruated from the breast. And Tufford reports a case in which there was re-establishment of menstruation by the mammy at the age of 56. Baker details in full the description of a case of vicarious menstruation from an ulcer on the right mamma of a woman of 20. At the time he was called to see her, she was suffering with what was called green sickness. The girl had never menstruated regularly or freely. The right mamma was quite well developed, flaccid, the nipple prominent, and the superficial veins larger and more tortuous than usual. The patient stated that the right mamma had always been larger than the left. The areola was large and well marked, and a 1/4 inch from its outer edge, immediately under the nipple, there was an ulcer with slightly elevated edges measuring about 1¼ inches across the base, and having an opening in its center 1/4 inch in diameter, covered with a thin scab. By removing the scab and making pressure at the base of the ulcer, drops of thick, mucopurulent matter were made to exude. This discharge, however, was not offensive to the smell. On March 17, 1846, the breast became much enlarged and congested, as portrayed in Plate 1. The ulcer was much inflamed and painful, the veins corded and deep-colored, and there was a free discharge of sanguineous, yellowish matter. When the girl's general health improved and menstruation became more natural, the vicarious discharge diminished in proportion, and the ulcer healed shortly afterward.